of my favorite ways to stretch the calf complex is actually a 2-minute stretch. It really isolates the outside of the calf as well as loads all of the joints on top of each other, so it actually helps move your shin bone back a little bit. A lot of times we get so tight through our calf complex and our shins shut off that this bone starts to sneak forward, and that's when you start to get kind of like that impingement pain on the front of the ankle, especially when you're trying to do anything where you stretch your calf. So that's why I typically like this one more than the other ones. It's also pretty easy to not cheat with this. So what you're going to do is you're going to start with your toes touching. You're going to have yourself up against a wall for stability, so you're not trying to balance, so you're not contracting that calf while you're doing the stretch. And then your heels are going to be apart to help isolate that lateral gastroc, and then you're just going to drop your heels down on the wall. Try and lift your toes up so that you get as deep as you can in that stretch. And then from here, you're going to actually tuck your hips to try and push your lower back against the wall, and then make sure your shoulders and your head are touching the wall as well. You're going to stay here for a full 2 minutes. What we're trying to do is actually decrease the neural drive to this muscle complex so that we can start to wake up those opposite muscles that have been shut off because of this muscular imbalance. A lot of times there's this issue with ankle imbalances and knee pain, and it's all stemming just from such a tight calf muscle that the rest of the muscles are not able to do their job. So remember, the pain actually gets a little more intense, typically between 45 seconds and 60 seconds before it actually releases. So just put a timer on, make sure you're getting the full 60 to 90 seconds in. And then when you come out of it, this one's always a little awkward, you feel kind of stiff, but it's completely normal. It's just that calf not firing as quickly and efficiently as it was before.